So when I think of Bill, I think of the word multidimensional. There are a lot of physicians out there who can achieve high levels of clinical competence, and that's him. And there are individuals who can become chairs of departments and do that in a great way, and that's him as well. There are people who can teach and train, and he does that as well. But there aren't all that many that can do all of that and do it with an incredible touch of warmth, humanity, and caring that he brings to that.
My father was a mechanic, so he taught me to take things apart to figure out how they worked. And fortunately, becoming a surgeon, which was the natural extension of that effort and that experience, he taught me how to put them back together again. My mom was like all moms. Her major focus was the children. Her love was unconditional. We came from a very limited background, but she taught us early on that the American dream provided opportunities for us to do whatever we want. And if we worked hard, were committed, disciplined, that the resources would be there to help us realize our dreams. And that did happen. But clearly the most critical moment in my life was my junior year in high school. I was at a football game and looked across the field and spotted a girl with brown hair, blue blazer, white blouse, pleated skirt, knee socks, and the proverbial lightning bolt struck. I fell in love, and that began a partnership that is uninterrupted for over 50 years.
First of all, let me set the record straight. It was Bermuda shorts I was wearing that day and knee socks, not a skirt. I really didn't have a vision of what Bill would do. I just knew that he was very smart, he was very funny, and he loved me. He has a wonderful relationship with our kids today. When they were younger, it was very difficult. He was so busy building a practice, and he has more time now, and now that they're adult children, he has a lot of fun with them, golfing and trips and crazy things they do together.
My dad's influence wasn't direct, throwing a ball, showing me how to start the car, learning how to drive a stick shift. His big influence is that his commitment to his patients, his commitment to his practice, and the influence he's had at Jefferson and medicine is what I carry for. That's what I think is the biggest influence for me.
I think Bill really enjoys the grandchildren because he gets to do it over. He gets to enjoy younger children. Having little girls in his life is just wonderful.
And spending time with him is just so much fun. I just love spending every minute of the day with him if I could. It just makes me so proud to see what he does for his patients and what he does for my grandma and our family. It's just unbelievable. I just love him to death.
So the Department of Otolaryngology is a long word, and people know it in a more colloquial fashion by ENT. It's a relatively large faculty whose major interest is in the clinical care in an academic setting with research of patients with diseases of the head and neck, whether it be cancers of the face, cancers of the sinus, problems with the nose, polyps, sinus disease, cancers of the thyroid, cancers of the tongue. So a host of cancerous lesions, but also a number of benign lesions. So people that don't hear, for example, or don't smell, or have visual issues related to diseases around the eye would come to be seen by us.
Bill is committed to providing patients with the most advanced possible care. One way he has done this is by championing the use of cutting-edge technologies. Under his leadership, Jefferson has become a pioneer in transoral robotic surgery. He has also led Jefferson's progress in using minimally invasive skull surgery. Bill also promotes a culture of teamwork, bringing together faculty from many disciplines to collaborate in treating patients. Congratulations, Bill, on this very well-deserved award, and thank you so much for your service to Jefferson.
Well, I first met Bill Keane. Of course, that was Dr. Keane back then, when I was a resident at the University of Pennsylvania. And Bill was an amazing surgeon, and is an amazing surgeon. When Bill operates, it's almost as if the tissue opens up in front of him and basically does and goes wherever he commands it. It was really for someone just starting out in otolaryngology, a tremendous experience.
Fritz Rutzius, he gave a talk about what you can do with your money, and he told me about that you can name departments. I thought, well, this is terrific. And I said, this department with this guy, Bill Keane, is going places. I'd like to have my name attached to that. I did it, and I am so happy because my name is going, even though I don't have an E on the end of it, my name is going along with what Bill is doing. I'm kind of doing a piggyback on his reputation, on his ability to be known. You're just known nationwide, worldwide. So it's such a treat. It's a real honor and a privilege to be connected with the Jefferson, with the Bill Keane department, of the Herb Keane department, with Bill Keane doing it. It's I'm on a joyride here at this stage in my life. It's great. I love it.
When Herb decided to endow the chair at Jefferson, I had the opportunity at that point to meet Bill and his wife Louise. And as soon as we met them, we clicked. We felt simpatico with them. We enjoyed their company. We had social events that we shared. We went out to dinner, and I came to know them as really a wonderful, warm, loving couple, both of them. We love them, and I want to take this moment to congratulate them and wish them the best of everything.
Yeah, no, I think it's great for our family. He's had a pretty amazing career in medicine and a pretty amazing career here in Philadelphia. The people he's helped, the families that he's helped. He's a very modest person when it comes to his accomplishments in medicine. So I think it's, for me, I'm very proud to be able to finally see some of those achievements in front of a group of his peers and his family. So, I love him very much, and we're incredibly proud of him.
I think one goes through the journey of life. Along that journey of life, you run into and have an opportunity to work and relate with a lot of people. Along that journey, you run into a few special people that really make a difference. They make a difference relative to their character, relative to their leadership, relative to their commitment, and relative to the example that they set for others. I think Dr. Keane is one of those unique individuals. And I think we're incredibly proud to have him as part of the Jefferson family. Dr. Keane, you richly deserve the award that you're going to receive this evening.
I am a teacher. My voice is extremely important. In 2007, I was diagnosed with cancer of the tongue. I was referred to the ENTs and Dr. Keane's office specifically. From the moment I met Dr. Keane, I knew I was in good hands. Shaking his hand put me at ease. He's so well informed. With him, we were able to detect it early. With him, we were able to operate really early. And with him, I was able to go through therapies early. Being a teacher for the last decade, I was worried that if I'd be able to go in a classroom again. I am able to because of Dr. Keane. I'm living proof that you can survive, and I've survived because of how thorough and how good he is at what he does. I'm able to talk to you now because of Dr. Keane.
People often ask me, what makes Jefferson so special? What is it about the culture that makes you proud to be a Jeffersonian? And having been at a number of medical centers, I can tell you it's the sense of family that Jefferson brings to the table. It's people that work together in a collegial fashion. I think it's fair to say that patients make a great leap of trust when they put their lives in our hands. And people at Jefferson understand that, and every day we see a patient, we understand the importance of that mission. It's unfettered by any other outside influences. Our sole goal is helping people get well. And coming to Jefferson 21 years ago was the best thing that ever happened to me because it reinforced that ethic, that commitment, and allowed our department and people at Jefferson to flourish.